Well, good morning, everyone. My name is Taylor Randall. I'm Dean of the David Eccles School of Business, and it's my pleasure to welcome you all to this segment of Navigating COVID-19, How to Save Your Business. This is being brought to you by the Mariner S. Eccles Institute of Economics and Quantitative Analysis, and we're thrilled to be able to stream this to all the businesses in Utah and beyond, thanks to the underwriting of the George S. and Dolores Dory Eccles Foundation. What you're going to hear today is an intellectual contribution between our faculty, Levitt Partners, and the Cynosure Group, and it's been exciting to work with those people. We're also grateful to the Salt Lake Chamber of Commerce for their input, as well as the Governor's Economics Task Force and the Utah Leads Together plan. Today, we're going to hear from healthcare leaders about what they're doing to get our businesses back in action and how to reactivate our economy. It's my pleasure now to introduce to you Spencer P. Eccles from the Cynosure Group. Spencer?
Thanks, Dean Randall. You know, it's been so appropriate that we've launched this executive series through the Mariner S. Eccles Institute for Economic and Quantitative Analysis at the David Eccles School of Business. You know, it was nearly 100 years ago that Mariner had to navigate and lead through another time of economic peril, first as a business leader, then, of course, as chairman of the Federal Reserve during the Great Depression. It was a challenging time. But, you know, just as Mariner successfully led his companies and this country out of the Great Depression, we too can lead our families and our communities and our businesses through this health and economic crisis, and importantly, back to strength and prosperity. We will make it through this. And as a family under our father's leadership and through the George S. and Dolores Dory Eccles Foundation, we felt it was imperative to help the business community. And of course, joining together with Governor Levitt and Dean Randall and drawing on the deep expertise of the Mariner S. Eccles Institute and the University of Utah, this series of discussions was developed to help business leaders, large and small, receive actionable, timely, and useful framework to help navigate this immediate crisis, as well as plan to get through on the other side. You know, we've been fortunate to work with Governor Levitt and with Dean Randall. Governor Levitt developed this pandemic plan with a $7.5 billion budget. But now we have the opportunity to listen to some experts in the healthcare industry, and we're going to hand it off now to Andrew Croshaw. You know, he has extensive experience in state and federal government, and he's currently the CEO of Levitt Partners, and we're grateful for him and his time and all of the other panelists that you're going to hear from today. Andrew.
Thank you, Spencer. In a time like this, as Utahns, we're very fortunate to have the leadership of the Eccles family and the U of U College of Business. It's imperative that we're communicating, that we're learning, and that we are evolving in a more rapid way and in a more unprecedented way than the coronavirus that we're dealing with. And you're helping us do that. Let me just run through our objectives for today. If we could do two things during the time we have together, we will be successful. The first is we want to address the top of mind business and health questions that Utah business leaders and employers have relating to what the state's doing and what the healthcare industry is doing to get Utahns back to work. Additionally, we want to provide clarity and give confidence to our business leaders and employers so that they can plan and follow a pathway to getting back to work. I'm really pleased with the caliber of the presenters that we've got today. They're all Utahns, but their experience and their leadership is national, and I think you'll find it to be uniquely valuable. I'll introduce each of them as we proceed. In the meantime, let me just introduce you to the topics and the presenters today. Mike Levitt will speak first and give us a sense of the national health and the economic perspective. He'll be followed by Chris Cox, who will talk to us about what the state is doing to protect the public health, but also re-engage the economy. We're really pleased to have Dr. Michael Good and Rob Allen representing the University of Utah and Intermountain. They'll be talking about what the healthcare system is doing to support Utahns getting back to work. And finally, Heather Wall will talk to us about vaccines, treatments, and cures that we can anticipate and expect. As we go through today's event, you're going to have a chance to ask questions to our panelists, and you can do that through the YouTube channel that you're watching right now. So please, as we go through, submit your questions. Those will be aggregated and organized, and we'll be anxious to get to those a little bit later. So let me now turn to Governor Leavitt. He, of course, is a 3-term governor of Utah, but he also had a public health stint as the administrator of the Environmental Protection Agency for the country, and then also served as the secretary of the Department of Health and Human Services. Governor Leavitt, what can you tell us about what's happening in healthcare that could help Utahns get back to work?
Well, thank you, Andrew. Today, I will address a series of questions. What do we know today that we didn't know 3 weeks ago? Let's talk about why it's so difficult to find a plan that will get us back to work. And lastly, what do we expect in the next 3 to 5 weeks? What do we expect in the next 3 to 5 months? How will this look maybe 3 years from now? So let's start with what do we know today that we didn't know 3 weeks ago? Well, could I say we've all become a bit of pandemic experts? There's a remarkable amount of information, most of it good, some of it not so good. Pandemics are part of biologic history and fact. They have happened through time, and they'll continue to. There may never have been a society better able to cope with a pandemic than the one we are in. The advances of technology, the developments of science, our capacity to communicate. When one looks back over time and sees what's occurred in pandemics past, those are enviable qualities. So let's talk about the last 3 weeks. Well, we now know that social distancing works. You'll hear more about that today. We're seeing very good responses. We have learned that the economic pressure continues to mount with this remarkable commitment that we have made to eradicate or to diminish or to, as we know now, flatten the curve. We have also now begun to see plans emerge. We've seen in the last 2 days, the president put forward some guidelines, and we will see today, something you'll hear more about, the governor lay out a track on which we can go over the course of time to advance as we have the ability to do that, going toward work. So the next question, why is it so complicated to devise this kind of a transition plan? Well, first of all, it's because there's still a lot we don't know. Will the ratcheting down of any social distancing cause a surge in the virus? That's not something we can take lightly. We've got to be very careful in the way we do this so as to not go backwards as opposed to forward. Second, we recognize that there are different beliefs about what the best strategy is, and since no one knows with certainty, we're going through a little bit of an iterative, step-by-step try and learn as we go. The third is that there are clearly differences in priorities that are playing out here. If one is healthy but being economically hurt, they feel differently about it than someone who is economically okay but might be in danger in terms of their health. There's an imperative here that we find the way to solve both of those problems, not just one. So what will this look like over the next 3 to 5 weeks? Well, it's pretty clear right now that the stay-at-home order that we're all living under and learning to adapt to will stay in place at least until the end of the month. But I think we can anticipate, as we'll hear more, that the first step back to work will likely come during that next 3 to 5 week period, and that we'll also begin to have an understanding of the possibilities of going to the next level. And we will also begin to see the tools of testing and tracing begin to become a bigger part of our lives. Those are necessary in order to deal with this pandemic. So what do we expect the next 3 to 5 months to look like? Well, we'll continue to progress through the steps of these plans, and hopefully we'll have progressed in that time through at least 1 and possibly 2, and understanding the potential for us to go back to a more normal situation. But we're going to be watching very carefully. We're going to be testing. We'll see a lot of tracing when the virus does show up. Businesses are going to be working continually during that period to learn to improvise For example, at some point, we'll be able to go back and sit in a restaurant, but it might not look exactly like it did before. We'll likely begin to see schools adapt in different ways. Decisions will be made on the schools during that period for the next year, and we'll begin to see hotspots crop up around the country. This will not be the end of those difficult periods of time, and we just want to avoid being one of them. What about the next 3 years? Well, can I suggest that this is a problem that we have to manage, not to solve? I read a great piece this morning by a man named Fred Brown, who said 9/11 was an event. The COVID-19 is the beginning of an era. This is something we're going to be with. This vaccine, rather this virus is in the wild now, and the process of bringing it to the point that it is no longer highly relevant in our lives is likely to be a long one. Will there be vaccines? Yes. How long will they take? Well, there's differences of opinion, but it's very clear that we've never done a coronavirus vaccine before successfully. So this may be a different proposition than we're accustomed to with an annual flu vaccine every year. It will likely be that we will see additional waves of this virus. We're going to have to become very good at the way we manage these kinds of situations with this virus over time, because it is likely that this is not the last time that we will see the need for social distancing. So back to you, Andrew.
Thank you very much. You shared some things that might be causing some of our participants today to need to reorient themselves. The idea that this is an era we're entering versus an event to be overcome. We'll get to that, and there will be some opportunities for conversation. But in the meantime, I'd like just to ask you, you mentioned the president releasing some guidance yesterday. How does that federal level guidance interact with the role of states in managing through this?
There are some basic functions that the federal government has that only the federal government can accomplish. For example, vaccines and medical countermeasures, very important. Second, they can stabilize the economy, and they're working hard to do that. The third thing they can do is aid states by sending money and helping and assets to help the states combat it. Another thing they can do is that they can begin to provide a coordination or situational awareness. They can also, in fact, begin to provide other assets. But here's the reality. A pandemic is different than any other type of an emergency. When I was at HHS and we were dealing with either, say, Katrina or 9/11, the plan for the federal government essentially was send state resources from areas that are not affected to the area that's affected. That's not possible in a pandemic. Every area has to essentially manage for itself using resources and coordinated information that it can get from the federal government. We will see Governor Herbert and those who advise him make decisions about how quickly we can progress through these steps to get back to normality. And the reason for that is that's the way pandemics require us to function.
Thank you very much. Let's turn now to our next presenter. Kristen Cox serves as the Executive Director of the Governor's Office of Management and Budget. The very fact that we have Chris with us today is a testament to how interested our governor is in the health of our economy. So grateful that you'd spend time with us today. I know you and your team are working around the clock. Can you tell us what the executive branch is doing right now to protect health, but also to activate the economy?
Yeah, thank you so much. And Governor Leavitt's points were just right on, as always. So, the first slide, I was really wanting to talk about this conflict we get into, the vacillation between protecting the economy or the healthcare. And we have to solve for both. Just to give you an example, we've had in total over 106,000 unemployment claims in 4 weeks. Compared to that is 90% of all the claims for 2018 and 2019. This is devastating to so many of our businesses in this state. And in that difficulty, we're creating some of the social determinants of care problems that the healthcare system has been really elevating lately. That is, if people have mental health issues, if they have poverty issues, all the social determinants that impact healthcare, we're actually creating in this environment. So it's a big challenge of how do you innovate and solve for both? And we have a working together with Levitt Partners and Ken Gardner Institute, Dean Randall, Spencer Eccles, so many people will have a plan that will be rolled out today from the governor. But let me go through a few of the points that will be highlighted in the plan, and we'll go to the next slide. The real strategy in this is, when we first started this, the first phase was to really try to time box the spread and then start building an infrastructure so we could transition back in slow, careful, vigilant phases back to work and back to some sense of normality. And I agree with the governor, it will take time and we need to be vigilant about this. Time box, what do we mean by this? We try to take a position of where can we be in a month from now and 2 months from now, and how do we reverse design to that? And it's a different model in that we're trying to establish goals and targets we can drive to in all of these very uncertain times. We had a goal for the urgent phase to get to a transmission rate, a pass along rate, how contagious is this virus, of 1 or less. And Dr. Good will probably speak to this as well. But good news is we've achieved that. As of yesterday, we've hit that. That's fantastic because of all the work that's gone on with stay at home, stay safe. Our testing capacity is building. That's huge. But moving forward, as we transition back, we have to be incredibly nimble at managing this. And I want to emphasize this. We have a tendency to try to solve problems through planning, through more forecasting, better predictive models. And when you have something as unknown as this virus, we're trying to impose certainty on uncertainty. And that just isn't a long-term sustainable approach. So we're trying to get, and we have now real-time data where we can manage and start moving on a dime. Where are the hot spots? Where do we have to move testing? How do we make sure people are safe? Do we need more masks? Do we need to set up more manufacturing? This is now an execution problem because we are in the middle of uncertainty and we've got to move on a dime. So let's talk about what this problem is we're trying to solve. You can see a next slide, picture of an iceberg. I use this a lot, trying to explain this challenge. We know it's what we don't know that's so difficult. Imagine with an iceberg, what's above the water, we can see it. We know what it is. We know how to move our ship around it. But 90% of an iceberg is below the water. That's what can wreck your ship. What we're trying to do here is find the virus that we don't know about. There's the positive cases, but some estimates, and we'll have more information as we really ramp up our testing. For every one positive, there's 4 other people out there who may be infected. How do we find these people so that we can contain the virus, keep them safe, treat them before they spread it? And this is not an easy deal, but this is something we're working on and we're excited about it. Next slide, I'll just barely touch on these tools. There's a lot of tools we're building, bringing up, and the stay at home, stay safe gave us the time to start building this infrastructure. Large scale field testing, survey, self-assessments, building up more testing capacity. That's huge, right? Finding ways to get more masks online with different projects and local manufacturers. Lots of things we're doing to build this infrastructure so that we can really start returning. You can go to the next slide. Transitioning back to work. And this plan that you'll hear about, again, this is a very collaborative effort, talks about color codes going from red to orange to yellow to green. And within each of those color schemes, what do we need to do? What does that look like for business, for individuals, for families, so we can get back to work, regain and start stabilizing our economy, and be safe at the same time? We'll be very vigilant as we move through this. And there'll be a lot of information coming out this afternoon when the governor does his release. We're confident that Utah can lead the way in this. It's important because we feel like we need to show other states that it's possible because we're all in this together. And I absolutely believe this is a mindset issue. If we believe we can, we will find a way. And we've already demonstrated that by being where we are today to start showing the nation how do we get back to work. We appreciate the work of all of the people on this group today, Levitt Partners included. Thanks, Andrew.
Chris, thank you very much. One of the questions that I know is on the minds of employers as they think about the safety of their own operating environment is, do they have an opportunity to have their employees regularly tested for COVID-19?
So one of the things we're building up right now is what and how and where can we use antibody testing or serology testing as a cheaper, kind of simpler way to screen people. We right now want 0 friction points for people to get tested. So let me make this first point. The states have received money, and we do not want friction points for testing. So the state needs to invest money to help build and support testing and the antibodies while we start normalizing. The state will help to do all we can to carry that burden. So in the next week or two, we'll be issuing guidance on how employers can access serology tests, antibody testing that's valid, and use that as a screening tool that people then can use for the traditional kind of PCR, the extraction test. So that's going to be coming online soon, and the state right now will do all we can to carry that burden for employers because they already have enough to carry.
Really helpful information. It sounds like then for now, symptomatic people are able to get tests.
Yes.
And we're expanding that. And it sounds like at some point soon, there will be ways for employers to have.
I think we've opened up the testing significantly. And the goal really is, ideally, is that anyone who wants to get tested can get tested. We know there's challenges with that, with false negatives, et cetera. But imagine if everyone in the state could get tested today, what that would mean for us. That would be huge. I actually did a quick graph this morning. I wish I had it here, but deaths per 1 million compared to the number of positives we know of and tests for those positives, a huge correlation. We have to get testing out there and make it much more accessible and available to the public and to our employers. And that is key as we move forward. Utah, we were lucky. We led out on some of this, and we'll continue to build out the capacity.
Thank you very much. I've seen similar data. Utah tests per capita far exceed what's happening in most states. Really appreciate what you've shared with us today. Looking forward to learning more.
Thank you.
Let's now move to our healthcare leaders. Going to start with Dr. Michael Good. He serves as the CEO of the University of Utah Health System. He's also the Dean of the University of Utah School of Medicine, a physician by training. Really pleased to have you with us today, Dr. Good, to share with us about what's happening within your system to protect your employees, to serve patients, to manage costs. Help us understand what you're doing to help get Utahns back to work.
Thank you, Andrew, and thank you all for being here today. Let me take a worldly view and then come back to Salt Lake City. And if I could have the first chart, please. This is the infection rate in South Korea. And as you can see, this plots the number of new cases of coronavirus each day. And you can see that South Korea was able to see the infection coming into its country, implement measures, and as we say, get up and down the infection curve pretty rapidly. You also notice that the infection curve does not go back to zero. For several weeks after getting up and down the peak part of their infection curve, South Korea continued to see about 100 to 150 new cases of coronavirus each day, but it was at a level that their health system was able to take care of every patient who needed to be in the hospital, who needed to be in the ICU or on a ventilator. And as you can see at the very end of that chart, in recent weeks, they've even taken that down to about 30 to 50 new cases a day. Precisely to Governor Levitt's point about learning to live with COVID, but yet have activities and an economy at the same time. We're very fortunate at the University of Utah. Our Asia campus is in Incheon, South Korea. There, Inha University Hospital, a 1,000-bed tertiary hospital that has been right in the middle, if you will, of the coronavirus epidemic and pandemic in South Korea. And so we've been able to collaborate with our colleagues in Incheon and at Inha University Hospital. They're a little bit ahead of us in dealing with this pandemic. And so we've been able to communicate with them frequently and look for and adapt best practices here at Salt Lake. Next slide. Kristen Cox referred to the infection rate. This chart shows the reproduction number. All of these are the same measure for each person in our community who gets coronavirus, how many other people do they on average infect? And you can see that back in the middle of March, right here in Utah, each person who was diagnosed with coronavirus was on average infecting 3 other people. And those 3 people would then infect 3 other people. And those 9 people would infect 3 other people, 27. And you can see how this multiplication the virus can run in an uncontrolled fashion through a community. And if you talk with family or friends in New York City, in Detroit, in New Orleans, when the virus is running faster than the health system, it's just very heart-wrenching, the things that happen, not having enough health care for all of those individuals who need it. So as you can see, the infection rate, the reproduction rate, the transmission rate in Utah is now it's right at 1, just a little bit below 1. That is huge from an impact on our community. The upper right inset is from the governor's task force, a similar measure of transmission rate. And also there, the gray bars show the hospitalization rate, the number of new coronavirus patients who need to be hospitalized each day. And as you can see, it's a number of 6, 8, 11 across the whole state. So the actions that we have taken have been huge in slowing down this virus in our community. The next chart shows what that lowering reproduction number means for the University of Utah Health. So you'll see 3 waves, if you will, on this chart. The first wave were our initial projections when that multiplication rate, that transmission rate, was at 1 to 3, each person infecting 3 others. If you carried that out, that would have meant 3,000 patients needing to be admitted to the University of Utah Hospital. We have approximately 600 beds. And as you can tell, that's math that doesn't work. But as that transmission rate came down, earlier this month, our projections were that 900 individuals might need to be admitted to our hospital. And with the transmission rate coming down even lower, the current projections are that in a worst case scenario, 600 patients with COVID would need to be admitted to University Hospital. And through our surge capability, we estimate our surge capabilities to be right at about 600 beds. So for the first time since this pandemic entered our community, we feel at the University of Utah Hospital, we have sufficient beds, sufficient ICUs, sufficient ventilators that in a surge situation, we could care for those in our community who were confronted with this virus and the symptoms and sequelae that it causes. Next slide. I'll just reinforce what other speakers have said. No matter all of the things we do in the future, test, trace, and isolate will be key parts of our strategy going forward. We have to continue to prevent this virus from moving from person to person in our community. And the best tools we have right now are to test and to isolate. We've really partnered with Intermountain Healthcare to make sure that testing is widely available in Utah. We have ARUP Laboratories, which was one of the first in the country to have the nasal swab viral test, and is also one of the first in the country to have the serology, the antibody test. And both of these testing capabilities are brought up at scale, large numbers, thousands and thousands of tests each day. And as shown in the picture, we've set up in-car testing sites throughout the county and indeed the state. Again, really hats off to Intermountain Healthcare for using all of their wide healthcare facilities throughout the state to help deploy this important test and isolate. Andrew mentioned, I think we're number 30 out of 50 states in population. We're number 8 in the country right now in terms of testing per capita. a line I like to use frequently, Utah is clearly punching above its weight. Next slide. I apologize for the busy eye chart, but just to allude to this concept that's been mentioned and is being developed by Levitt Partners and the state, of us starting to think of red, orange, yellow, green, different states or conditions of our regions or of our communities, and the responses that we need in each of those. Right now, many of us, we've kind of been in a red condition, stay at home, only essential businesses are open. But I think because of the tremendous success, this community has come together, has really knocked down that transmission rate. As you've heard, and is going on in our legislature, we're getting to the point where we can enter a different phase, where in a careful and safe way, but additional activities and businesses can resume under orange and then yellow and hopefully someday green conditions. I can tell you here at the University of Utah, we've already begun to adopt this strategy broadly in our university. And in fact, yesterday, President Watkins tasked force a Project Orange team that would begin to outline what the university functions broadly would look like under a condition of orange. So again, thank you to our community for all you've done. Hopefully those transmission reproductive rates charts show you what an impressive accomplishment that we have accomplished by working together.
Dr. Good, thank you very much, not only for sharing this information, but the work that you're doing as a collaborator in our community, leading out on this. What you just described a moment ago that's happening at the university, where a project is underway to design how an organization can operate in, let's say, an orange environment as opposed to the more stay-at-home environment or the red environment that we've been in now. That seems like the type of an idea that would be very helpful for businesses across the state as they learn more about what red, orange, yellow, and green means. May I just ask you a question? While unfortunately some businesses have employees with COVID, many, many more businesses have employees that have chronic disease, that might be receiving treatments right now, that may be in need of other therapies unrelated to COVID. What are the treatments and procedures that aren't happening right now, and when is that part of healthcare going to be operating?
Thank you, Andrew. As a new and unknown virus approached and then struck our community, we took a number of actions in healthcare to make sure we were best prepared to take care of our citizens that would come down with COVID. And if we had one of those large surges on healthcare, as we've seen in other cities. For example, many elective procedures, both surgical and procedures like colonoscopy, have been halted the last few weeks. We didn't know how long this was going to happen. We didn't know how tall or wide the curve was going to be. But because of the success that we've had here in Utah, we are at a different point right now. And you point out something very sensitive. Just in the last few days, this week, our healthcare leaders have been looking at what we'll call time-sensitive procedures, time-sensitive surgeries. We need to get back and taking care of those patients. For example, so much of our healthcare is now being accomplished very well through telehealth visits. We're doing thousands and thousands of telehealth visits each day. But if in one of those telehealth visits, I determined that my patient, I'm worried about the potential for colon cancer, and I want my patient to get a colonoscopy, that's a time-sensitive procedure. And so we're actively working in conjunction with Intermountain, with HCA, with Stewart, with the other healthcare systems in our community to figure out how we can, or not to figure out, to begin resuming time-sensitive healthcare in person and procedures and so on. And then if we can accomplish that in a safe and effective manner, we're also beginning to look at outpatient surgery as a next step after that. So yes, people that have healthcare needs, make sure we're doing the things we need to do. Contact your health professional. Initial communications can be through telehealth. But if you need care that requires a face-to-face visit, we're going to get you in and we're going to get you seen and cared for.
Thank you again very much. Let's shift now to another major health system in our state, Intermountain Healthcare. Really pleased to have Rob Allen with us. Rob is the Senior Vice President and the Chief Operating Officer at Intermountain Healthcare. Rob, we're interested to understand, what is Intermountain doing right now to keep Utahns safe, but also to support them in getting back to work?
Thank you, Andrew. It's a pleasure to be here with you all virtually today. And keying off of Governor Levitt's comment about what we have today, and technology plays into what we're able to do right now, what we've been doing, and frankly, what we can and will need to do in the future. So I want to talk a little bit about how we're coming together on this front to serve you and our community broadly through this crisis. If we could tee up the first slide, please. We are building on a long history of targeted collaborations across the healthcare industry here in Utah. We're collaborating with partners and have a united front in our efforts to battle this common foe, COVID-19, or this new coronavirus. You'll see in the lower corner of this a set-up tent. This is actually in Park City, where we joined forces, the University of Utah and Intermountain Healthcare. We both have service sites there. We have a hospital there, and at the ice rink, we set up a common space for easy access in the community and to serve the community well. This was early on efforts to try and make sure people had access to get tested without getting into crowded waiting rooms and potentially contaminating other people. And as Dr. Good has noted, it has been very positive in its impact in slowing things down for us here in Utah for the spread of this virus. You'll also see up in the upper right-hand corner a clip out of the newspaper from April 8th, noting Intermountain and the University of Utah's combined research efforts studying the malaria drugs. I'm sure all of you heard early on about the assumption made from some experiences had that these drugs would treat this illness. We don't think it's quite that easy, but our researchers are very much engaged in researching that to identify when and how these medications may be used successfully to treat patients, and are in trials right now to do that. Next slide, please. Telehealth is a critical part of our pandemic strategy at Intermountain Healthcare and here in the state of Utah. And it's critical for a lot of reasons. When we think about how easy this virus is spread in face-to-face or hand-to-hand contact, this is an opportunity to create distance for people to get care in many different scenarios, and certainly in that initial diagnostic phase for them to get care. Connect Care is a product Intermountain launched a number of years ago, and it's helping us to flatten the curve as we focus on improving the care to patients when they need it. And it's part of our flow of access points, where you can get this remotely through your phone, an iPhone or Android, through the App Store, and connect into a provider remotely and have a video visit. It was originally designed for urgent care needs. And if you had an immediate need and couldn't wait to see a doctor and weren't sure if you needed to go to an ER or an Instacare, you could use this tool to have a visit and understand. And then if you needed to be referred, then you would be referred without initial charge to those right places. We've been able to deploy it to effectively focus on COVID-19 and help people be guided through their care needs if they had symptoms and were worried about that. The rural environment is also an area of great need. And during a time of something like a pandemic with new disease that's evolving, where everyone is seeking answers to understand how to diagnose and how to treat appropriately patients and the people in their communities, we're able to use telehealth to connect specialists from our major medical centers out into our rural communities and make sure that everyone across the state has access to the kind of care timely that they need, as they're concerned and at times fearful about, are they infected and what does that mean and how do they get treatment, etc. As the pandemic fades, we will also continue to use Connect Care as a way to treat. This is a way to get your employees back to work. This is a way to have assessment of them if there's any symptoms at all, and make sure they're routed into the right care models. It's probably important to note here that this is also a tool to be used for during social distancing to get care that you need without having to go to sites for the non-COVID-19 items that you might be facing. Unfortunately, as this pandemic came, we didn't shut down everything else that we needed. People still have accidents. Although I believe that there's fewer car accidents than there were before as the roads are a little more clear. People still have heart attacks. People still have emergencies. People still have needs, and they can get that care through the normal channels. Wherever they would go for that care in the past, they can still go and get that care. But Connect Care provides a great avenue for that care going forward for those things that are moderate to minor. Next slide, please. This is interesting, and I'll share a story. I grew up on a farm in Wyoming, and when I was a young boy, my grandmother ascribed to many of the old pioneer remedies. One of those was every spring, she would send my grandfather up into the mountains to peel the bark off quake and aspen trees. And she would bring that home and put it in a great big pot, and she would boil it for days. The belief was that if you drank this quake and aspen bark tea, that it would cleanse your blood and it would help you stay healthy. Now, as a young boy, I don't know, and I never knew if that was really effective. What I did know is it was nasty medicine. It was painful to drink. I hated it. Every springtime, I hated it when they would get out the pot and start boiling the bark. But in this case, the medicine that we're having to take may be equally as nasty, but we do know that it's working. And that is really important for all of us to know. For the pain that we're going through in our communities and in our society by the social distancing, the slowing of economy, it is making a difference. And this chart that you have here shows the graph over time of Utah cases day by day. As you'll see, there are some spikes along the way. Our infectious disease experts tell us that's common in this as they follow the spread of the disease along. What's really good news here is you do not see a hockey stick effect in that trend line that's going through. And that's what we see when it starts to surge. Our hope always is that we will be effective enough to totally avoid that hockey stick. We do know that we've been effective enough to slow it and mitigate some of the impact, even if we start to see that. So this is largely very, very good news. We've slowed by 43% the evolution and spread of this illness from what it was projected to be. And we hope that the efforts, and believe that they may well even be mitigated further by the things that we've already done. Now, what you will see here too, and probably the cautionary note, the last couple of days, you've seen a spike up again. And in fact, what was reported in the last 24 hours, I should say a day and a half ago, because this will be updated again in a few hours with new data from yesterday, we saw the fourth highest spike of new cases. What that means is that although we've seen great success in the work we've done already, the virus is still spreading in our community. So whatever we do in next steps, we need to do very cautiously, very measured, and work diligently to keep the distancing within the new confines of any steps we might take so that we don't launch a new spread of the virus and see it spike again and put us right back at the beginning. And that would be even more devastating. After the pain we've gone through, that would be like me having to have the quake and aspen bark tea every Monday as the next week rolled around. And I wouldn't have wanted to do that then, and I'm sure we don't want to go through what we've been through again. So finding that right timing is critical for us. Next slide, please, if you would. Healthy people are essential for a healthy economy. And that is a critical piece that we think a lot about as we move forward. Each of us will play a critical role in keeping healthy and keeping each other healthy. As we look at forging the path into the future, it's already been talked about that the targeted tools for containing an outbreak is the contact tracing and robust testing, both diagnostic and antibody. Much work here to be done, but we're all anxious to expand that out further and make sure that we deploy the tools as effectively as possible to help us keep that virus in check. Maintaining our community's involvement, each of us plays a role, and that is critical. And we will continue investments jointly across the health industry and in coordination with state and other leaders in the communities to make sure that we are developing through research and trials every new piece of evidence and understanding we can gain to treat and care for people and keep them well. So we will continue to have a united front as health systems and ask our communities to continue in a united front to really take advantage of the progress we've made and make sure we don't slide too much as we take next steps. Next slide, please. So with that, these are contact points for you to help you know where to go. We've set up a string of things in our flow. There's a symptom checker. If you think you might have the illness, go on and go through this process, which will help you identify what your concerns and needs are. You then have a hotline you can call as well. Contact numbers there. Telehealth we talked about with Connect Care. It's an app you can download. Emotional support line. There are a lot of emotional and behavioral health needs coming out of this. and we want to make sure everyone has access to care for that. If you want to just follow latest information, there's a blog site there and then some other ways that you can follow. So grateful to be a part of the dialogue today. Thank you to the business community who've had to swallow very nasty medicine in this process. But we're here with you. We are also an employer, and we want to make sure we can get back to work and in the normal scope of things just as bad and just as fast as you do. But let's do it thoughtfully so that we get to the right place and keep our community safe and not have to go through that cycle again.
Rob, thank you. Thank you very much. Intermountain has an insurance arm. What happens if an employee in the state gets COVID? Is that covered by insurance, and what is that going to do to insurance costs?
Yeah, really great question. So first, everyone should know, if you don't already, that through a number of directives, both insurances themselves standing up, government directives that are in place, your insurance will pay for any COVID-related treatment and care. There's no copay, there's no deductible for you. That should be fully covered. For those that are uninsured, which becomes a question as well, can they get access to care? And the answer is absolutely yes. And through the stimulus packages that have come out, there's been provisions made to make sure that that's taken care of also. So if anyone has any question or concern, get treated, get tested early, get what you need, and you should be covered one way or another for that care to be provided for at no cost to you. As business owners, I guess the cost point might be your second question, Andrew, and that is, what does that mean for insurance costs going forward? There are a lot of factors that go into setting insurance rates, and as you all know, there's government regulations that define what can or can't be in policies. There are choices businesses make and what's defined within those policies, and then there's trends of use. So how often are surgeries done? How often are testings done? How does all of that roll together in the overall cost? And insurance rates are set every year trying to look at that and project the very best they can what that cost will be to cover the group of people who are buying the insurance. So we don't know the impact of that yet, but we do know that all of those factors will come into play as they always have been in the past, and rates will be determined based on what those all point us to going forward.
Again, thank you very much. And just a reminder to those watching, please be submitting your questions there on YouTube, and we're moderating those, and we'll be turning to those momentarily. Before that, however, we're going to have a final presentation and talk about a very important topic. Something we're all thinking about is, when will there be a vaccine for this? How does that process work? What about the other medications that could be helpful in addressing COVID-19? We have with us here Heather Wall. She serves as the Chief Commercial Officer for a new company in Utah called Civica. Civica is a collaboration from Intermountain, also together with other health systems, including the University of Utah, that was built to address supply chain shortages in our medication system and solve some very important inequities and shortages in a supply chain system. She's very close to what's going on the medication front. Heather, thank you for being with us. Tell us what Civica is doing to get Utahns back to work and how this whole vaccine thing plays into that.
Thank you so much for having me. Good morning. And thank you for the introduction to Civica. I know that everyone knows who Intermountain Healthcare and the University of Utah are, but I do suspect that not many know Civica. And I thank you for mentioning that we are a drug manufacturing company started by health systems, but it's also important to note that we are a not-for-profit drug manufacturing company that has over 1,200 hospitals across the country that are part of our consortium. Building on the collaboration we heard today, our health system partners include Intermountain, University of Utah, Steward, HCA, and the Veterans Administration. So we get the opportunity to serve most of the large health systems that provide healthcare in Utah. 10 of our Civica medications are being actively used in the treatment of COVID patients in hospitals. These include antibiotics, sedation medications for hospitalized patients, pain management medications, and others. We've had the privilege to deliver daily, overnight, and on weekends over 1.5 million vials of the medications being used to actively treat COVID-19 patients. In addition to being a drug manufacturing company, we are a Utah small business. We are headquartered in Lehi, Utah. We have less than 30 employees across the country. And in the course of the last few weeks, we have been doing nothing that we would consider business as usual. We have an office space where, as an essential business, we are physically present, but we are only allowing for 10 or less employees in our building, and even then behind closed office doors. We have hospital partners in all 50 states across the country, and so we have the ability to receive and hear direct COVID-19 related treatment information from New York City, from New Orleans, from Seattle, Washington, from Michigan, from California, from Miami, Florida, and from most of the other hotspots across the country. I'm really proud of the amount of work that Utah has done in preparation to assure that we're both slowing the spread, but also that we're actively ready in case Utah does become a hotspot. We are making great progress, as you've heard, in reducing the number of future potential COVID-19 patients, and we're ready for what may come. Even though we are not a manufacturer of vaccines, since we are a pharmaceutical manufacturer, we get questioned frequently on the timing of a vaccine for the COVID-19 coronavirus. Currently, most medical and public health experts believe we're about 12 to 18 months away from any viable vaccine. Last month, there was some news about an experimental vaccine being administered in Seattle, which was one of the first hotspots. So there is somewhat of a misconception that a vaccine will be readily available. Before a vaccine can be submitted to the Food and Drug Administration for validation that it's both safe and effective, long-term clinical trials have to be conducted. These clinical trials start with very small groups to assure that the drug is safe and effective. These groups then are expanded to look at patients with very specific health characteristics. Then it is expanded to thousands of patients to make sure that it does what we expect it to do. And all of these things take time. That being said, there is some significant momentum behind accelerating those timeframes and having a vaccine available across the world. Right now, there are almost 80 worldwide vaccines being developed globally. As a country and as a world, we are not lacking COVID-19 patients. So that will allow for the development time of the vaccine to be shortened as much as possible. On Tuesday, the National Institute of Infectious Disease Chief, Dr. Anthony Fauci, said that if the case counts continue to be as high, that it may be possible to finish those larger studies sooner than the 12 to 18 months he'd originally predicted, of course, with a caveat that they are proved to be safe and effective. This was followed up by Dr. Corbett, the scientific lead of the National Institute of Health's Vaccine Research Center, stating that they are currently testing a vaccine with a target goal for emergency use for healthcare providers in the fall and spring for a more broad use. I do want to spend a couple of moments talking about a few of the medications that have been on the news over the course of the past few weeks. Hydroxychloroquine is the anti-malarial medication that Rob Allen just referenced, that is used to treat malaria and rheumatoid arthritis, and that early on was deemed as one of the promising treatments for COVID-19 patients. It's important to note that the data for this came from a study with 36 patients, and only 20 of them were treated with hydroxychloroquine. Hydroxychloroquine is not without risk. In fact, some of the side effects include heart issues, seizures, and others. So having solid clinical outcome data for this drug and for any other drug is essential. Many healthcare and academic hospitals across the country are now collecting treatment data on hydroxychloroquine. And in fact, Intermountain Healthcare and the University of Utah are partnering on a clinical trial that studies the effectiveness of hydroxychloroquine. So we're hopeful that it can be a good COVID-19 treatment medication, among others, once it's been deemed safe and effective for appropriate use. There are many other medications that are being assessed right now for the treatment of COVID-19 patients, including medications that can help fend off severe lung inflammation and other antiviral medications like remdesivir and others. This week, new data is being reported that remdesivir, a medication that was developed for the Ebola virus treatment, is showing significant promise for treatments with COVID, for patients with COVID-19, to be able to rapidly recover from pretty severe symptoms. Once again, that being said, it's important to make sure that the treatment is appropriate before we say that it is ready for broad use in the broader population. Most of these medications, including remdesivir, have seen increased manufacturing production in the course of the last week as manufacturers try to think through how they meet the needs of the the patient populations across the country. They're being used in clinical trials, and there's a lot of work being done to make sure that they are effective. I mentioned the increase in manufacturing production. We've seen and may continue to see a significant delay and a significant disruption in the distribution of needed medications and goods across the country. In the United States, we do purchase medications and supplies from all around the world. As some countries have chosen not to export medications, at least in the short term, during the COVID-19 pandemic, we are seeing disruption in the ability for us to get some of the medications, or at least the time frame associated with us getting the medications. This is where we've seen some of the good in the world come. We've seen pharmaceutical manufacturers come together to figure out how we can get drugs to the places that they are needed. We are also seeing the supply chain the supply chain see where there are concerns and folks coming together to address that. That being said, we are also very big fans of having pharmaceutical manufacturing be brought back to the United States or be in the United States so that we can control that even just a little bit more. Andrew, what I hope the group will take away from this is that while COVID-19 is absolutely impacting us as a state, and it was not something we expected as a nation and definitely weren't expecting locally, the responses, it's been impressive. We've seen the good come out of people and companies as they work together to make sure that we are treating patients and trying to keep patients healthy. So thank you for the opportunity to talk to the group this morning.
Heather, thank you. You know the situation with the availability and the latest data on the effectiveness of medications. So my question for you is, if you could have medications like hydroxychloroquine, some of Rob Allen's grandmother's bark tea, or social distancing, what's the best medicine, what's the best tool available to fight coronavirus of those three?
So, Andrew, the answer is yes. There isn't a best, right? We have got, as a population, we've got to have the ability to make sure that we are not transmitting additional COVID-19. And that is what that social distancing and the wearing of face masks and really making sure that we are being thoughtful and appropriate as we engage with others, that has to happen. On the flip side, people are going to get sick. And so we need our brilliant minds in medicine doing the research and trying to figure out exactly how to treat patients in the most effective way. I love that the data changes on a day-to-day basis. I love that it's evolving because it means that we are not just taking something that exists now and assuming that that's going to be the solution. We have people working to prevent, and we have people working around the clock to make sure that the most effective treatment for patients is available. And so it's all of them. It's not one, it's not the other. We really have to be very, very thoughtful in making sure that we are focusing on prevention and treatment at the exact same time.
Thank you.
Thank you.
Now, why don't we shift to questions that would have been coming in from participants in the webinar via YouTube. And my colleague, Bo Nemelka, is with us to participate in this. So, Bo, what are you seeing there in the feed? And why don't you bring forward the first question?
Sure. And Chris Cox may have to excuse herself and wanted to make a final comment. So, Andrew, would you mind if we gave Chris a bit of time to do that?
Absolutely. Please, Chris.
Thanks. No, heading off to the governor's exciting press event. First of all, Levitt Partners, Taylor Randall, Dean Randall, Spence Eccles, and others. It's great. Dr. Good, everyone on this group has been fantastic. I've learned a lot. I thought there was a really important point that I think we need to I want to end with, is that we will still see, even when we go back to work, people getting the virus. And as Dr. Good talked about in South Korea, they still have the virus. This is something that we're going to have. It's about learning to live with it. And how do we watch so we don't have at-risk populations that really are sensitive and have it, they could have to go to the hospital. Watching the at-risk populations while we see the virus, how it's working within the general population is key. So this idea as we move back that we're going to be virus-free, I think is important to overcome that. We will have it. We don't want to see it spike. We don't want to see it go exponential. It's how do we contain it and especially protect at-risk populations. That's a key part of our strategy. I wish you all the best for the rest of the day. And thanks so much for coordinating this, Andrew. Always good to be with you.
Thank you very much. Appreciate it.
Thanks. Bye-bye.
All right, Bo.
Great. Thanks, Andrew. Our first question is for Governor Leavitt. Historically, pandemics have been deadlier in subsequent waves, and we're starting to see areas in the country where they're reopening areas, and it could be concerning. Is this a concern for COVID-19? What measures should we be taking to prepare?
I'm pleased we have a chance to talk about this. It builds on what Chris Cox just said and others. This is a long process. It's a marathon that we're running, and that there will be periods of time when it reappears. Historically, as the questioner suggests, there are waves, second and third waves, and they occur when the virus has a chance to thrive again because of access to more hosts. That's just a biologic fact. And again, it comes back. Is it a risk? Absolutely. We're already beginning to see it. And I think we're all now beginning to understand the nature of this challenge is to learn to live and manage around the virus and to keep out of its way and to minimize its impact.
Thank you. Bo, let's bring another one on.
Great. We're getting, Andrew, several questions about antibody testing. Is that being done in Utah? Once we know who is immune, how might we then handle that? Can these people go back to work? And then a lot of questions about masks. Should employees be wearing masks? So wondering if we can address those two topics.
Thank you. Let's start with the immunity testing. And Dr. Good, perhaps we could start with you on this. You mentioned that there is some now immunity testing beginning. How is that going to scale? How quickly could we expect that to be prevalent in our community?
Thank you. A little over a week ago, ARUP Laboratories received approval and began performing antibody tests. When an individual is infected with the coronavirus, there is an initial immune reaction, so-called immunoglobulin M, but at about 14 days, pretty consistently, we see the immunoglobulin G, the longer lasting antibody in our body. Coronavirus is new. We don't know how long those antibodies will exist. We don't know how long they will give an individual a presumed immunity. But we are hopeful, based on our understanding of other coronaviruses and other viruses, that when we see these antibodies, either we will not get infected, our body is able to fight it, or if we are infected a second time, and there are reports coming in from around the world of individuals experiencing a second infection. But our thoughts are that with antibodies, that second infection, our body already has a head start on attacking the virus. And so we do hope that having antibodies is a protective mechanism. As I mentioned, the testing capability just came online a little over a week ago. Initial tests, we're looking at healthcare professionals on the front lines, those who are taking care of COVID patients, and also planning to help look for antibodies in our first responders and others in our community who are in contact with COVID patients by the nature of their work. We do plan to scale the ability to perform antibody tests from hundreds of tests a day to thousands of tests a day. And as Chris Cox mentioned, we are in the process of putting together how do we adapt our existing testing sites? Who are the members of our community that we first want to get tested and assessed so that they can be perhaps a little bit more comfortable as they go about, still within the context of maintaining physical distance and so on, but presumably with a little bit more protection inside their body. Certainly these antibodies are what slow down previous viruses and previous endemics and pandemics that we've dealt with, both as a country and a world.
I hear two really encouraging things in what you're saying, Dr. Good. Number one, this may be the type of virus that does not require an annual vaccine to it. We don't know that. We don't all get measles vaccines every year, but we do get flu vaccines every year. And so I hear some encouraging, at least indicators in what you're saying. What's also encouraging to me, though, is that you're saying here in Utah, we now are producing and beginning to have the capacity to do that immunity testing, which right now we know there won't be much immunity in our social circles, but over time we would imagine that would become a really significant measure to have access to.
Andrew, excellent points. And to the last one, we are working with the state and other partners planning to do some field testing, perhaps 10, 12,000 randomly selected individuals, part of our community, representative of our community, and test both for the virus and for the antibodies. So we begin to know, do 10 or 20% of our community already have antibodies, or do 30 or 40? For different viruses, when you begin to get up in the 50, 60, 70% of a community with antibodies, the virus is not able to run through a community like it has in New York or Detroit, for example. So in addition to our testing centers and testing those who come into the hospitals, we are looking to do a broad sampling across our community, and perhaps not even once, but perhaps on periodic basis, so that we can see if immunity is building over time.
Thank you very much. Very helpful. Bo, you mentioned a lot of questions about wearing masks. Frankly, I'm glad to know that there are a lot of questions on this topic. I think as Americans and as Utahns, we recognize that our cultural orientation to mask wearing is different than other cultures. We've observed that in airports or when we've traveled internationally. There seems to be clearly in our country not a familiarity and an orientation to doing that. So, Rob, perhaps I could ask you to comment on this first and then invite the other panelists to weigh in as well. How should we be thinking about our employees wearing masks as we begin to move back into an economic operating environment? What's going on at Intermountain among your employees? And what are you recommending in terms of the general public or other working environments?
Yes, Andrew, thank you. Really important question as we try and figure out how we get back out and interact with each other. The CDC guidance right now is that we should wear masks when we're in public to prevent the spread. The CDC guidance on this has evolved over time as we've gained deeper understanding of what the virus is, how it's spread, and what that all means to us in our efforts to knock it down. Initially, there was concern about using hospital-grade masks and not having enough personal protective equipment, masks that caregivers could use as they take care of patients who are sick and keep them safe. With that, the CDC's guidance is to not have hospital-grade masks used in public because that's not the level of protection that's needed. And in fact, it's as much and maybe more about making sure that you don't spread the disease or virus as keeping you from catching it. If you put yourself in a caregiver situation, taking care of someone with COVID, very close distance with it, these cloth masks and things that you might use in the public normally wouldn't be sufficient. But when we're out and about and just passing on the street or going to work and working somewhere in general proximity to others, it's a really good idea, and it will help a lot for us to do that as we go forward. Those that are at most risk are those that are interacting with more people closely. So in your work environment, as you think about your business, just think about what setting your employees are in, what you're asking them to do. What can you do to separate that work into a little broader space, keep people a little more distanced? And masks in some fashion are a really good idea now, and we've been asked to wear those when we're out in public just to keep everybody else safe.
Rob, thank you very much. As you think about the settings where we are with 20 people or more, thinking about sporting events, church, school, should we be thinking about those kinds of events in the future where everyone's wearing masks? Is that where we're going to be until we have, a level of immunity that protects us otherwise?
It's a great question. I spent some time living in the Orient, and those cultures very much ascribe to wearing masks for keeping the society safe, which is really what we're now starting to think about. And you're right. When I was a farm boy in Wyoming with the cattle out in the field, I didn't think about wearing a mask when I had a cough. It didn't much matter. But if you're in New York City, if you're in downtown Salt Lake City, or if you're in a business setting where you go in and you're working closely together, there's a new risk we now know about. And we should be thoughtful and careful about how we interact to keep each other safe. In our work environment at Intermountain Healthcare, we talk about 200% accountability when it comes to safety. I have a job every day when I come to work to keep myself safe in the job that I'm doing, and I have a responsibility to keep you as a coworker safe. I think we should think about the next phase of our journey together in that light. We have responsibility to keep others safe as well as ourselves. And that mask is something that helps us do that now. As we gain new knowledge, we may find different ways and different things that we need to do. I don't know about getting, the stadium filled with folks watching a football game in the fall, if we'll all need to wear masks then or not. But I can say this, it would be more safe than if we all got in the stadium and didn't have them, because it does help. So we'll have to figure our way through that. But that's something we're going to have to, as a society, figure it out. I can just tell you that we continue to learn that effort on our part will be required, not just to get through these first phases, but to get through the journey that's ahead of us, has already been stated. This is probably a multi-year journey at least, and we're going to have to be thoughtful and probably do some things differently than we used to do.
You raise a great point. I know none of us after 9/11 felt comfortable going through a TSA line. Taking off our belt in public was not something we had done before. The hassle of taking off shoes, jackets, the screening and the pat down was something everyone was uncomfortable with, but we understood why it was happening. And over the course of time, we've just become accustomed to it. And I wonder if we're going to do something similar with wearing masks, and that we'll not look at people who do them as hypochondriacs or concerned about themselves, but actually as a gesture of consideration for others around us.
Yeah, agreed.
Thank you. Bo, what other questions do we have?
Yeah, Andrew, we're getting several questions about the red, orange, yellow, green process. And this might be for Governor Leavitt, yourself, who've been a little bit involved with this, both at the federal level and now we heard from Chris that it's happening at the state level. Can you give more details on what that looks like and how that impacts a business owner?
Thank you. Governor Leavitt, may I turn to you to start first?
Yes, I think we should acknowledge that the governor is going to be announcing at a news conference as we speak the details, and therefore they will be available and people can get a lot of information about them, and we'd encourage them to do that. So let's just talk in basic terms, the way a level we all remember when we were in just out of 9/11, when they implemented the various stages of terrorist threat, and they were linked to colors. I think we will undoubtedly begin to see a similar kind of arrangement in Utah and in other states and around the country begin to emerge. I will offer this analogy. I often travel to the east from Utah, and so if I'm going to New York City, I will often check the weather, and there will be a winter storm warning that I need to be conscious of. And in fact, in some cases, I just decide not to go because the storm is going to shut down the airports. You won't be able to move around. People will not be at work. Things will not be normal. In the future, we could easily see that kind of alert for a period of time because of a COVID-19 hotspot. And that would be a reflection of the fact that certain indicators had been developed in a way that said there's more danger here for a period of time. And we'll designate them with colors: red, orange, yellow, and green, with red being the most significant social distancing. These are referred to as intermittent social distancing. That is to say, different levels of social distancing used intermittently. And so during those periods, when we're at something other than green, there will be different types of social distancing measures taken. For example, it may be that in red, there's no activity in restaurants. In orange, there would be delivery at the curb or at a window available. At yellow, it may be that we can enter the restaurant and sit down, but there would be more social distancing created. So maybe people would be sitting at every other table or something in that neighborhood. And then green, things are as they are. So if we talk about gatherings, in red, we're asked not to gather. In orange, maybe family members that would be able to gather. In yellow, it may be that groups up to, say, 10 or 20, depending on the jurisdiction and the time, would be permissible. In green, we could go full scale. And so we'll all become acquainted in our own industry groups with the type of changes that we need to adapt to based on the color in these intermittent social distancing measures that keep us safe. Andrew, you may wish to add to that.
What you've laid out, I think, describes really well. And your weather forecast example is a great way to think about it. We prepare differently when we anticipate certain weather conditions. And in the context of COVID, that will be an industry by industry response according to the color. A hair salon is going to need different guidance for keeping people safe than a builder supply will. But it's important for both organizations to get back to work within and consistent with the guidelines provided by the state. And we can expect those guidelines to be coming immediately, as in today. I'm sure they'll change over time as epidemiologists and policymakers understand more about the disease and its impact. I think one of the key things that a business owner or employee could take from today's conversation is it would be very unwise to take a course of action that says, I'm going to wait for COVID-19 to end and then get back to work. Everything we've talked about today suggests this will be an ongoing risk to manage. So the opportunity will be to develop ways to operate within a safe environment and to be consistent with these gradations that will be issued by decision makers who have access to information. And that's I think, something that we can all innovate around, we can all be creative around, and we can all move forward so long as we operate within those gradations. Thank you for your comments on that, Bo. Great question. Glad you raised that one. Maybe we have a chance for probably a couple of more questions, and then I'd like to just ask one final question to our panelists.
Great, Andrew. This is our last question. So this is for Heather, and it's talking about the population who might be more vulnerable. And we are in a state that has those people as well as spread out across the state. Could you speak to the vulnerable populations?
Yeah, I actually can. You know, my mom falls under that category. And so it is really important that we as a population think about what we're doing and the way that it affects others. You know, we need to be very thoughtful about not only the social distancing that we're doing for us and for our families, but for the other families that we are going to be impacting and that will be, you know, that are impacted because of what is occurring. We need to make sure that our family members, our neighbors, those folks that we know are immunocompromised have the help and care that they need to be able to also be able to, do what they need to, and hopefully eventually get to those back to work states as well. So if I could ask anything to the group, it would be, let's make sure that we're checking in on those around us, because you are going to have some folks that are scared because they are immunocompromised, and the treatments for them are going to look very different than treatments for other people. So taking care of each other is going to be really important as this continues. It was important this last month. It is going to continue to be important as we kind of go through different stages of both opening the state, but as well as to to what has been referenced, going back and forth between what we expect to see in regards to COVID-19 and other potential issues in the future. So just watch out for the folks around us as well.
Heather, thank you very much. So I'd like to just go back to each panelist for what I'm going to call a lightning round here and ask you a question about healthcare. You all are as involved as anybody in this and have a unique perspective. And the question I have for you in a lightning round setting, and let's start with Dr. Good and then Rob and then Heather and then Governor Levitt in that order. How will healthcare for Utahns be different as the result of COVID-19?
Well, I appreciate you asking me to go first because that part's easy. Telehealth. Telehealth has evolved probably more than a decade in just a matter of weeks. And although the ratio right now is all telehealth to very few in-person visits, and of course the in-person visits will come back as we get to orange and yellow and green. But I think telehealth is here to stay in a very profound way. It's more convenient. It'll provide greater access to care. So my answer is telehealth.
Thank you, Rob. Rob, you may be on mute.
There, I was. I had a really good answer too that I already gave, so I'll give a different one. No, my answer would be the same as Dr. Good's, actually. I do think that the way healthcare is delivered is going to change dramatically from what it was. Some of the barriers that we faced before in thinking about these new areas and changing the way that we provided care to new ways for the future were inhibited by certain regulations. And because of the need now to actually free that up so it can be used, a lot of those have been lifted, at least temporarily, and in many cases, we think permanently, and allow us now to do things differently that I believe will be better service for those in our community, make it easier to get the care that you need, and provide it at the right level. So I'm excited about that opportunity, and I think that will dramatically change. And I think the other side of that, and this is the piece I would add, is that our communities are learning how to actually access services differently than they did in the past as well. So I think it's made us all more comfortable with using technology to keep ourselves safe, but also still function somewhat in society and build relationships together and socialize and get services. So I think there's some exciting things on the horizon for that.
Thank you. Heather.
Yeah, I think we're going to see a change here in Utah in the way that the last thing that I mentioned was kind of the distribution and supply chain. I think we're going to see an increase in strategic appropriate stockpiles for making sure we have medications readily available to treat patients if and when we do see surges. I think we're going to continue to lead in some of these fast-moving trials and assessment and continue to evolve treatments. And I think that's fantastic. I also think that we're going to continue to learn from others. Yesterday, I was on the phone with a couple of our pharmaceutical colleagues in New York and New Orleans, and they were so happy and so quick to be able to offer up what they had both learned, but also what they had available to share in either medications or in personal protective equipment. And I see that type of sharing from state to state, from community to community, becoming the norm, as opposed to, or I hope it becomes the norm, as opposed to us being very isolated in the way that we do research, the way that we choose to administer medications. And so I think that here in Utah, we will end up being one of those areas that shares information and receives information, and really it leads the nation in things like that.
Thank you. And Governor.
I believe in the future, we will have an orientation toward prevention like never before. This healthcare system is changing in the way it's compensated, away from just a fee for every service toward payment for value. A key component of that has been looking upstream and asking ourselves, how can we prevent hospitalization? How can we prevent people with chronic diseases finding their way into the hospital? I think our entire society will become so conscious of this that prevention is going to become an ethic. And it will not just be institutional prevention. It will be as Heather pointed out, we'll be looking after our parents who may have some vulnerability. We'll be building a moat around them to protect them. We'll be looking at the behaviors that we have that make us more vulnerable. The way we live, what we eat, the way we exercise will have an impact. We'll begin to see our place of work, begin to think about how can we prevent disease. We've had that as an idea, but I believe this pandemic is going to make it an ethic.
These are very encouraging to hear, and I think a great way to leave today's conversation and look forward to the next. As we close this out, I'll just take a moment to first of all thank the Eccles family, the university for their support of sponsoring this kind of conversation, and I'd like to, if I could, just personalize this a little bit. Personalization is difficult in this era of Zoom calls and so forth. But like everybody watching this today who participates in a business, I have worries about the cash position of my suppliers and of my clients. I worry about employees who are affected by these changes. As a parent, I've watched my kids grieve the loss of important events in their lives. Not just time with friends, but participation on teams or celebrating milestones in their lives. But I have experienced something that's perhaps different than most people watching this, and that's that I've had an opportunity to peek into the inner workings of what's going on right now in the state government in Utah, and to observe how the leaders of our healthcare infrastructure are operating. And here's the perspective that I want to leave with you, that we should be proud, very proud, as Utahns, of the level of unselfishness and collaboration and innovation that's taking place right now within state government and across healthcare and between industry and government. I see an enormous effort underway to protect not only our lives, but our livelihoods. And for that, as a citizen, I'm both proud and grateful. And I want those watching this today to know that that's the perspective that I have. This is a very difficult time that we're all in. It's unprecedented, and inherently, therefore, there are a lot of things that we're learning, and we're not going to get it all right. But there's a lot of innovation and collaboration happening at the state level. So as we leave today, I would invite you to do this. Take time to become familiar with the Utah Leads Together plan that Governor Herbert is announcing today. It's version 2.0. It has industry-specific guidance and a description of this varied gradated mechanism that we'll be able to use to get Utahns back to work. So thank you for joining us today. Look forward to more conversations in the future. Take care.
Andrew, thank you very much for that careful and thoughtful conversation you've just led, and thanks for your sentiments. We appreciate all our panelists today. Hope you've enjoyed the insights that they have provided to all of us. We're grateful for the George S. and Dolores Story Eccles Foundation for underwriting this series. As a reminder, this is a continuing series on Tuesdays and Fridays. This next Tuesday, we'll be taking a deep dive into the state's guidance on how you get your business back to work. As a quick reminder, that's the color guidance system, red, orange, yellow, green. We'll be talking with industry experts on what you need to do to get your business back open and operating. Thanks again. Keep your wits about you. We're going to get through this together.